everybody, I am Dr. Valeria Soltanik, and today I'm going to talk about pain in the joint area, pain in all this area of the mouth, the headaches that can cause it, and the problems that can cause in the teeth. So, especially during the pandemic and now in this period after, the patients are coming complaining of severe pain around the jaw, on the ear, the headaches, and breaking teeth. Not only this is caused by stress, but only because of functional problems. So I have a lot of patients that are coming referred from the ENT, from the ear, nose, and throat doctor, that first these patients go there because they have pain in the ear. And after the ENT doctor examining them and finding no problems with the ears, so they refer these patients to us, the dentist. Why? Because the only problem could be the TMJ joint, the clenching, the grinding, the bruxism. So we start treating the patient for these problems. We analyze the patient. So another problem that the patient presents is complaining, I wake up with a lot of pain, I wake up clenching the teeth, or some patients even present with broken teeth. And when I ask the patient, did you eat something hard? How did you break this tooth? I didn't. It broke with a soft potato. So I asked the patient, are you under stress? And I have several patients that they tell me they're under a lot of stress due to personal problems, to world issues, or things that go on at home. Everybody has a problem that can translate into something like this. So I examine the patient and I do an intraoral exam. I palpate the muscles outside, like this muscle here. I palpate this muscle here, the masseter, which is a very strong muscle of mastication, very, very strong muscle. If you palpate it, if you clench, you can see how strong it is. And some people, when they're under stress or just because they're heavy built and their muscles are very, very strong and tight, you can see how tight this muscle can be. And this muscle, by being tight and hardened by stress or multiple things, it would start making you clench and it will radiate headache into a headache, or even start clenching and pressing, thus could possibly break the teeth. So another exam I do is I go intraorally and I palpate with my fingers to see how the TMJ area is from inside. And in some of these patients, it's very, very tight, very, very hard. And even when I press, they feel the pain. So what do we do in these cases? First, we treat it with some form of a cushion of a pain reliever. And I like to do an eye guard, like a mouth protection that the patient will be using at nighttime. Why? Because at nighttime is when we clench the most. Even while we're sleeping, it's something that we cannot control. So we designed this night guard, something like this. It's I like it, the silicone one. It has to be custom made. I would suggest not try to buy those at the supermarket, at the grocery store where you do your own. No. Why? Because those will create something uncomfortable in your mouth, and your mouth has to be in harmony. So imagine biting into something chunky that it's not perfectly done. It will cause more damage, more stress, it will be uncomfortable and later will cause more problems. So this is a custom-made NIGARD for a patient. So it is custom-made to go around each of the lower teeth. So once the patient puts this on, and look how soft it is flexible, yet it's not as thin as a whitening tray, for example, or any tray that we use to put any medicines or things like that. So it has some thickness, but comfortable, and the patient puts it. Usually I like it to do it on the lower arch because it's more comfortable, and just because of gravity it stays well there. There's a lot of open mouth sleepers, and so I prefer this, although we do some upper NIGARDs as well for the patients that prefer like that. And you put it on, you sleep with it all night very comfortably, again because it is custom made, and that acts as a cushion. It's like a sandwich, and it will relax this joint area here, because the bone here on the mandible rests on the top. The joint is going to be like this, and if you relieve a little bit by opening this up by using this cushion, it would relieve the stress in this area. So at least while you're sleeping and while you're clenching, that will cause a relieving action. I have several patients that, due to the stress that they're going on, while they're using the NIGARD, and they locked the jaw so that the amount of opening is limited, with the treatment of a NIGARD, they start gradually to open and open and open until they can fully open their mouths. And also the people that have the clicking sounds, all is because of this, because the joint area. Some people, because of malocclusion, which is when your teeth are not aligned and your bite is very off or just off, then they start to develop these joint problems, because everything has to be in harmony to work well, to work perfectly. Even if something is in harmony and you put an ingredient that disrupts this harmony, in this case stress or anything, or maybe a fall, then you start getting these problems. That's why we have to start treating with something very simple as a NIGARD. So also, it's not just stress sometimes. Why do I know this? Because I get a lot of patients that come, I see the adults, and they tell me, I have my baby, a 2-year-old, 1.5-year-old, and while they're sleeping, they make these sounds, they clicking, clenching sounds. So I explained them, it's something natural. It's a habit of this clenching thing. Because why would a 1-year-old, 1.5-year-old have stress? No. So it's something that they just start doing. So I don't do NIGARDs on a 1.5-year-old. So I tell them that we're going to wait and see as they grow, how, if it worsens or if it goes away. So that's something to keep in mind. And as always, I say, I'm going to deviate a little bit from this topic. Always take as long as 1-year-old, or as long as the first tooth erupts, take your baby to the dentist to have an exam, just to hear what the dentist will say, to guide you how to treat the teeth, because it's very important. So going back to the TMJ pain, sometimes when the pain is very, very strong and we're starting this treatment, I tell my patients, do some warm compresses on and off, to try to relax the muscle here. Also, you can do some massages to relieve the tension all around this area, and start here on this temple area, and you're going to go down, down, and you're going to feel the tension. So try to break a little bit the tension in these muscles here. Here, go all the way from here to even here. And you can even go from the inside to relieve the tension. Like this, I'm gonna go like this, and all the way to the outside. Very important. Like, you have to take care of your own areas here. Very important, so that you lose this tightening stress here. And very important again to add something like a night guard. Also, someone that's under a lot of stress and it's working from home, like now we have a lot of people working from home and still going with stress. If you're at home, you don't have to talk so much, just working on a computer, or even those that are studying, they're stressed, and you have your night guard already, then pop it in during the day, because you're also stressing your muscles. So that's another way. Is a night guard, I always tell my patients also, it's not just for the night guard because we call it a night guard. It is also, if you need it, you can use it a few hours during the day. So it will also help release the tension. So also, some of my patients tell me, oh, I cannot use that. I'm gonna pop it out at night. Okay, you're gonna pop it out at night. We're humans, we're used to habit building. So, okay, you're gonna pop it out for after 2 hours, 1 hour. Gradually, don't give up. You're gonna use it. I prefer you use it. Start using it for 1 hour, then 2 hours. You're gonna get used to it. Your mouth gets used to things. So build the use of it. For those that say it's difficult, because I have a few that say that, but after a while, with persistence, they tell me, oh, I did that. I used a little bit each night, and now I can gradually use it all night. So don't give up. You have to do your treatment. And then some people, we have to do a hard night guard. And those are the patients that are already used, and they tell me, oh, I need a hard one because I cannot use these. I break them. So we do a hard night guard. There are several types of a night guard. The soft one like this. Then there is one that's a combination hard soft, which is hard on the outside, and the inside it's more cushioning. And then we have the full acrylic night guard for those that are extremely heavy bruxers. So the idea with all of this is for you to relax the muscle, protect the teeth, because this is going to be a sandwich protecting the teeth, and not to break the teeth. So I tell them, I want you to break this. You're gonna dig the holes. Those heavy bruxers, after a good while, they're going to make little holes around this with the teeth. So that's okay. It's time to get a new one. But you didn't break your teeth. Your teeth are intact. But this we can change. And that's the idea. That's the protection. That's the treatment. So yes, bruxism and grinding will cause tooth breakage. I have patients, especially during this time of the pandemic, that they come with broken molars, cracked in half. Because yes, these muscles have the power to create such a strong force that they're going to break teeth. So molars broken, front teeth broken, the edges of the teeth all ground. So very important, let's take action, because some of those broken teeth are so broken, the line, the fracture line, it reaches the root that we cannot save those teeth. I have extracted, I would say, hundreds and hundreds of teeth since 2019 to now because of stress breaking. So, and these had to be extracted, and we had to do bone grafts and implants because they cannot be saved. So let's protect our teeth. Let's take care of all the areas surrounding our teeth, the muscles, the joint, because we want to have longevity of all our teeth. Very, very important. And then we're going to talk about the bite and occlusion in another video, because a bad occlusion, when the teeth are not aligned properly, will cause damage and wear of the TMJ area, the temporomandibular joint area. So I hope this video will help answer a lot of your questions that I get, and thank you so much for watching my videos. Don't forget to subscribe to the channel, and thank you very much.